So, hi guys, welcome everyone. I'm waiting for others to join as well. We will start the webinar soon. Just give it like 1-2 minutes more, yeah? So, I see around a few of you have already joined. So, let's start. Maybe the others will join soon. Okay, so I'm Dr. Rutuja Kulkarni. Hello. And I'm an MD dermatologist in Germany. So today's webinar is on how to land a competitive field like dermatology or any other competitive field in Germany. So I'm first going to give you a slight introduction about myself. Before I start with it, I just want to let you know whatever questions you have or anything you can write down in the comment section and we'll go at it at the end of this webinar. We will go through all the questions. So, I started my journey. First, I started my MBBS in I did my MBBS in India, and then I came to Germany in 2019, and then I prepared for my licensing, my recognition of my Indian degree, and then I started my dermatology residency. So I directly got into dermatology. How I got into it, that's what I'm going to explain in today's webinar. And those points also are similar to get into other competitive fields as well. So first I did my MBBS, then I did my internship. So during my internship, simultaneously I started studying the German language because I knew it for sure that I'm going to start, I want to come to Germany. And during the language preparation after my internship, I still had like a few months, almost a year, I would say, where I was preparing for the language. So, what helped me was this 1 year I used to gain derma experience in India. And after having that 1 year experience on my CV, obviously that added value to my CV and it helped me get better opportunities in Germany. So that's one thing I always tell all the students who come to me or who I'm guiding presently, that make sure that when you're in India, try to make your CV very oriented towards your field of choice. For me, it was dermatology. Whatever is your field of choice, please make sure that you use that time to get or gain experience in that field. And then after that, I came to Germany. Before coming to Germany itself, I made sure I send applications in Germany for hospitations. What is a hospitation? I will be explaining it to you ahead in the further slides as well. And during my preparation for my licensing exam, that is the FSP and the KP, I made sure in Germany as well, I do 1 or 2 hospitations, which gain more weightage on my CV towards dermatology. And sometimes, if you're lucky, during the hospitations, if they like you, they might offer you your PG residency seat itself that time. And after my KP was cleared, I applied again to the places where I had done hospitation, and I got the PG residency in dermatology, and I started doing it. I'm going to even explain you how the whole journey was for me during my PG, what were the topics that needed to be covered, how many hospitals I was in. I'm going to explain all of that, but I just wanted to give you a gist before that. So let's go ahead. Okay, this was my journey, like I explained to you, from MBBS, then the German language, then getting all the documentation done, during that gaining the experience in India, then going to Germany, then clearing the FSP, that is a Fachsprachprüfung, then doing these hospitations, and then starting as an assistant arts. And finally, right now, I'm working as a Facharzt, that is a MD specialist in Germany. So how does the post-graduation work exactly in Germany? So there is a differentiation. So like for medical post-graduation, that is a non-surgical post-graduation, it's of 5 years. In that, these are the branches which are included. That's dermatology, neurology, cardiology, internal medicine, peds, radiology, psychiatry, onco, endocrinology. That's around 5 years. And the surgical post-graduation comprises of 6 years. That's like general surgery, neurosurgery, orthopedics, ophthalmology, gynecology, and that I would say it is around 6 years. And during this post-graduation period, how it exactly work is that you have to fill a logbook where there are different topics that you have to make sure you're doing during your residencies, and your PG guides or your what you call HODs can sign on it. So for dermatology, what exactly were the topics that were important in my logbook that needed to be filled? The reason I've included this slide in our seminar is because I had a lot of queries from MD dermatologists in India if they can directly start working in Germany. So sometimes if things from these topics are included in your curriculum of your PG in India, you can try getting them recognized. I help with the recognition process as well. So accordingly, I will be explaining you. So if these things comprise in your curriculum of your PG, you can try getting it recognized from your university in the form of this logbook, and try getting it recognized here in Germany. So what all comprises here in dermatology? One is the allergology. That's basically the allergies and everything. That is a completely different spectrum which is included here in dermatology. Photomedicine and everything, I think, is also included in India. Venerology is also included in India. Dermatohistopathology is also one section which is comprised in our logbooks. Proctology is also included here in dermatology. I don't think that was included in India, but correct me if I'm wrong. Dermatosurgery is also one of the important parts, because here in Germany that plays a very big role, because there are a lot of cases of skin cancers, and unlike what we have back home. So yeah, that plays a very big important part. So what is actually included? This is phlebology. That's the veins and the vascular things, like peripheral vascular diseases and varicoses. This is included differently in India, but here it is included in dermatology. So maybe they might see that you're deficit in this subject or this area, and they might recognize not fully the post graduation. That's possible, or fully your experience. So you have to cover those things. And what exactly the system in Germany is that different doctors have licenses to provide these what do you call it, specialties. Not, it's not like a one stop hospital that you go, you apply in any hospital or in any private clinic for the residency, and then all the topics are covered under it. Sometimes only half of the topics are covered under it, and then you have to, change the hospital to cover the rest of the topics. And that's what I also had to do during my PG. I had to change around, like I would say, 3 hospitals in together to get all of these topics covered and get my logbook filled till the end of residency. So this is an idea of dermatology, and the other fields is also similar to this. And yeah, So now getting to the point where how to strengthen your CV to get into it. So you have to, when you come to Germany, make sure that you apply to hospitation. Hospitation is what? Basically, hospitation is like a unpaid clinical observership, which takes like it's placed in a German hospital or a German clinic where you shadow the main doctors, attend the wards, consultations, procedures. You're not treating, you're just doing like a observership. So that how does it benefit you, because that lets you firstly understand the German medical system, makes you gives you like a real insight how the procedure is, how does it work in the German medical system, in the hospitals. You get to know people, you get to introduce yourself into the departments. It strengthens your language skills also if you are in the hospital, which helps you in turn to prepare for your licensing exams also. And obviously it strengthens your CV when you put it on your CV that you have it. So that is why I always tell everyone that no matter what, apply for hospitations. And one very important thing is, I would not say apply for one hospitation, do it and that's it. Apply for as many as you can. Maybe you do 1 month in a private clinic, maybe you do 1 month in a university clinic. You see what you like. If this is something that is, um, that you like or you want to do. Maybe you want to do dermatology, but after doing the hospitations, you're like, no, I don't think this is something I want to do. You want to try hospitation in other fields. Do that, because this is your time to understand what you want and what you don't want. So make use of this time while you're preparing for your FSP and KP. So then you can understand till the end of your KP exactly what's your target specialty. And make sure during these hospitations you ask questions, you're curious, and you make an impact so that they remember you. And always after your KP is cleared, make sure you follow up with these HODs. You send them a mail, tell them that you've cleared your exam and that you're looking for a position for doing your post graduation. And if you are like, sometimes it works out if you have made a good impression there. So always try applying for hospitations. So let's go to the next slide. What competitive departments actually look for? Like I explained in the earlier slide, your German language levels, you have to have a higher German language level. B2 is the requirement to give your exams, but what makes your CV more stronger is if you have a C1, they will, if there are two applications with the same qualifications, but you have a B2 and the other one has a C1, the C1 will be preferred over you. So it's best that you always aim to do a C1 language level. The Bewerbungsunterlagen. So what does this mean? Bewerbungsunterlagen basically means your application, what you send to the email to the departments. It has to be in a certain format. Anschreiben means you have to write it to the particular department why you want to do your PG there. What do you like about that department? Why are you so motivated to do it there? Lebenslauf means your CV that you have to prepare in a specific format. Zeugnisse means the certificates, what all you have gathered, let it be your experience in India, your PG in India, your clinical research, your thesis, your hospitations, your medical license in India, in Germany, everything you have to put it like in your application, your German language certificate, and you have to make it in a certain format. And that's where we come into play. We help you make this application properly so that we target the right specialty, what you want, and at least make sure that you get an interview. Because here the PG is not like an entrance exam. You have to apply to the hospitals individually and they will call you for an interview where they will see if you're fitting in into the team or not. And during this interview, sometimes they tell you to do a small hospitation for a day or two to see if you're getting along to the team, and not just for them to like you, but for you also to like the department. That's also very important. The other thing that strengthens your application are the reference letters. If you're in your home country, make sure you have like reference letters or some, like we call it Empfehlungsschreiben, like who can write it for you, like about your work, your character. That makes a lot of difference. And make sure you get it translated by a German certified translator as well, because that reference is really, really important. And not just in your home country, also if you're doing your hospitation here and you make good contacts during your hospitation, ask them if they can, politely ask them if they can give you reference letters which can help you strengthen your CV more better. The clinical experience in your specialty. So this is what I already explained you, all the years that you worked in India or your home countries, all the hospitations, all of that. And not just, I mean, working as a doctor, but any clinical experience, let it be doing a research, a clinical research, or a thesis in that subject also adds value to it. Or if you have done courses or certificates for dermat, like there were a lot of courses, like you have to do laser courses, like aesthetic courses, that adds a lot of value to it. So the next point is research and publications. Like I mentioned earlier, research and publications in the field of choice makes the application much more stronger. And the hospitation. So I think we have covered all the 6 points. So we can go ahead with the next slide. So what if you can't get directly into the field of choice? So I'll be very honest with you, it's not easy that you apply and you get it. Maybe you send 100, 200 applications and 2, 3 answer you back, call you for an interview. Sometimes it works, sometimes it does not work. But what is the good part about Germany is that if it's like a 5 year specialty in case of dermatology, then um, if you're not getting directly into dermatology, I always suggest to students maybe try a field which is a little bit related to dermatology, maybe the vascular surgery department, or maybe rheumatology, or maybe internal medicine. Why do I say that? Because if you work 1 year in those departments, it's counted in your PG time. So then you don't have to do dermatology 5 years ahead, you have to do it 4 years. Like you can change your hospital after a year, but that time in that 1 year you have that experience. And if you write in your experience that you have what you call it, seen dermatological diseases during this 1 year of experience, and try to make it more derma oriented, it will help you. So even if in the first go it's not possible, we create a strategy where you can still apply into dermatology. So do not be disheartened if in the first go it doesn't happen, but there is always a possibility to change the field. And if it is changed within 1 year, that 1 year is counted in your post graduation. That's very important. So, yeah, like these steps, what we have mentioned here, you come to Germany, you clear your FSP, then you secure any hospital position. So, with the FSP, you are allowed to apply, allowed to work on a temporary license for 2 years, and that time it's it's individual choices. Either you can start working in a hospital and gain experience, or you can directly give your kindness proof. That's the KP. But like I said, it's a very individual case-based scenario. And hospital, like what you say, then you work for 6 to 12 months, you apply for the hospitation in the targeted specialty. And then once you are done with everything, you apply again with experience. And this year counts in your logbook, like I mentioned before. So now going ahead with the dermatology logbook. So which fields you can apply so that later you can switch to dermatology. Like I explained, you can apply in internal medicine, you can apply in pathology, general surgery, immunology. Like the things which I have not mentioned here are also rheumatology or vascular surgery, because they add a value to it, and dermatology, it has like a connection, those diseases with dermat. So, mhm. So the salaries. So during your post graduation, the salaries are same for all the fields. Like there is a standardized salary system in Germany, irrespective of which field you are in. Let it be dermatology, neurosurgery, internal medicine, cardiology. All are paid same as a assistant arts. That is a residence. So it does not matter in which field you are in. The salaries are always the same. Only the exceptions are when you apply to a private clinic, sometimes the salaries may vary, because there it's a private clinic, it's not with association with the standard salary structure from the government. So sometimes there the salaries can differ, but most of the times the salaries are same. So what do you get in your first year? It's around, these are the actual salaries of 2026. It's around 5,533 gross. That is like before your taxation, which comes to after taxation, which includes your health insurance, pension, and everything, around 3,000 to 3,300 euros. That's around 3 lakh to 3 lakh 60,000 in your first year of your residency. Second year of your residency, it increases up to like 350 to 380 lakhs per month. So every year there is like a 1-2% increment during your residency. This is just during your residency. After you're done with your residency, the salaries obviously are different. But during these first 5 years, the salaries continuously keep rising by 1 to 2%. Like if you start with 3,000, 3 lakh 30,000, then maybe till your fifth year you reach around 4 lakh 20,000. One thing that I want to mention here is that if you have prior experience in India or have done your PG in India, again, irrespective of whichever field, when you apply for the recognition of that experience or your PG here in Germany, either that can be recognized and you get a salary, or what you call it, the salary year increases. Like let's say you have done 3 years PG in India, so you get directly a third year salary if your PG or your experience is recognized. That is very possible, and we have done that for a lot of people. So you don't start from this salary, rather, you start from this salary. And then obviously the salary increases accordingly, uh, according to the experience. But this is one thing I thought it was important to mention, so that because of the lot of queries that I have had so far. Okay. And one more thing, which I forgot to mention here, is that this is your base salary. So if you're working in a hospital and you're doing emergency duties, so that is counted as a different, it's counted in your salary, but you're paid extra for it. It's like extra supplements, maybe for night, 20% extra, for weekend, if you're working 25% extra, if you're working on a public holiday, 35% extra. So if you do like 3 to 4 duties, like 3 to 4 emergency duties in a month, the net salary can increase like above your basic salary by 1,000 to 2,000. So that's also something we need to take into consideration. So let's go ahead. Okay, so I'm just gonna like again give you like a gross idea what we have till now told and how do we play a role as Team MedZiel here. So we basically always don't have like a one go plan for everyone. We talk to the students, we filter them out, we see which specialty they want to do, and accordingly we decide what kind of a pathway we have to curate for them. Okay. And just one thing I forgot to mention in the earlier slide was the cost. A lot of you have been asking about it. We have a separate video on YouTube regarding the salary costs. So if you're interested, you can also check that out. Yeah. So coming back here, what do we do? So once you enroll with us, we make sure you have a timeline, a curated timeline according to your field of choice, and then we start preparing you according to that timeline. Like first, obviously, the first initial step is starting your German language. Then we see which state is suitable for you. There can be various factors which are taken into consideration. Um, like maybe like some state you want to go because you have family members there, friends there, or some state you prefer because it's more expat friendly. That all will be spoken to you, and according to that we will decide which state selection you have to apply to. And yeah, then once you apply to the state and your documentation process is going on and maybe you're still in your home country, we try to make your CV more strong. We try to we tell you how to gain the experience, like what all you're supposed to do, simultaneously send hospitation applications here in Germany, simultaneously also give you study material for your preparation of language and everything. And Then we go to the next step is that we apply for your FSP and KP classes. So this one thing, it's one of the topics which I've spoken in my previous videos as well. You can refer back to it. It's about the funding. What exactly is this funding? It's basically your FSP and KP classes can be government funded in Germany. There is a way to do that. It obviously depends person to person, every student, but till now, whichever students we have had, we have got 100% success rate in funding their FSP and KP classes. So we help you save that money there. We have explained about this in our earlier webinars. You can refer back to it where we have discussed that in details. And that is something where we can save the costs on as well. And then we help you understand during this preparation phase what all cost which you have paid for the preparation, how do we get it tax deducted so that you get some amount of money back from it. So that's also where we come into play and we help you prepare for it. Then your documentation, attestation, visa process, everything will be, we'll be guiding you through and through. Until now, we have got 100% visa acceptance rate for all our students. Our documentations have also been completely clear. There hasn't been a problem so far. And I hope it continues to be that way. So that's something we help you, because visa rejection is one of the major reasons people are stuck. And we know the hooks and nooks where we can help you so that your visa is 100% accepted. And like I said, alongside then we'll be preparing you for your FSP and the KP preparations. Other than the material what your classes provide, we'll also be helping you understand what you need to study, from where you need to study, what material you need to use. That everything will be guided through MedZiel. Then, like I said, alongside when you have to apply for your dream specialty, the hospitation applications will also be simultaneously, guided from us. So mock interviews. What exactly is mock interviews? We'll help you prepare for your visa interviews, for your hospitation interviews, for your PG residency interviews, and we'll fully prepare you so that there are better chances for you to get in and have a better visa acceptance rate. So, yeah, lastly, we as co founders, me, then Dr. Fez, Dr. Nigel, we will also help you. We have like specific calls which you can set with us to understand exactly how the system works here and everything. And you can set a one on one call also with us. Okay, so now I think that's all, and we can go to the question and answers in the Q&A round. And like I said, you can ask any question, let it be related to dermatology or neurosurgery regarding today's webinar, like which field you want to get in or regarding those things, and I will try to answer all of them. So write your questions. Maybe we can take a 5 minutes pause and you can write your questions in the comment, and then we can come back to it soon. So I'll be back in 5 minutes. So we are back. Thank you for waiting. I was just going through the questions and yeah. So let's go through the first question. So, what is the entry level salary of a dermatologist after completing PG in Germany? Okay, this is a really good question. So, like I said, I explained about the salaries during your residency. After completing your dermatology, it depends on where you want to work. Again, if you want to work in the private sector, then the salaries can completely vary. And if you want to work in a clinic, that's a university clinic or any other hospital, then the salaries are different. It's because the hospital salaries are regulated, like I explained. So those salaries are around like 8,000 to 10,000 euros in hospitals, depending on what level you are at. At the Fachärztin level, you start, you can go above to a Oberarzt level, that's like a associate professor level, and then to a Chefarzt, that's a HOD level. So these are the levels in the hospital. But the starting salary, entry level salary after your MD is finished, it's around, I would say, 8,000 euros to 9,000 euros in a hospital. But if you start in the private sector, the salary is completely different. It depends on your negotiation skills, as like how it works in India or in US that way. It can be around 8,000 to 10,000 euros or 10,000 to 14,000 euros as well. And in private sector, you can always have like above your basic minimum salary, also like percentage of procedures, like you can get salary according to that as well. And yeah, so like then that is above your basic salary, like how much you get paid and everything. Okay, so let's move to the next question. One second, just one second. Also, one thing I wanted to add on to this was I have attached below these links. I don't know if you can see it. I'm going to just put it here so you can see it, to actually go through the webinars, like about the steps of getting into post graduation, about the costs in Germany, where we have explained about the salary structure and everything. And you can get on these links and check those videos as well for the salaries and the other things. And if it's not possible to click on the link, just go on our YouTube page and you will find all of these webinars there. So make sure you go through them as well. So let's go to the next question. Um, okay, this is for the first question, I guess. Okay. Hello, doctor. I'm doing MBBS from Georgia in 2026. Is it mandatory to get a license from my study country to apply for approbation? So this is more of an FMG question, and we have hold a webinar about FMG, which again we have shared the links here in the comments, and you can definitely go through that webinar because our my co-founder Dr. Nigel is expert in it. And if there is something that you want to discuss, you can always set a one-on-one call with Dr. Nigel, and he can explain you about the FMG way of getting the approbation and the recognition process better than me. So it's best if you get in contact with him or set a one-on-one call with him. Or first, I would say please go through the webinar of FMG and accordingly you will know. So like here is what you can do to set up your free discovery call with our operational manager in Mumbai. Or if you want a call with me or Dr. Nigel or Dr. Fez, you can set up a one-on-one paid call for any other queries which you think are not answered in the webinar, like the other webinars as well. So let's go to the next question. What's a good time to reach out to you? I'm in final year, fourth year, not internship. So if you have already made up your mind that you want to come to Germany, you can always reach out to us at any stage, but we always tell the students that it's best to reach out once you have started with your language process. And I always recommend the students to start their language process as early as possible. It's an individual's choice. You can start it in your final year or during your internship, however you want to manage it. But the best time to reach out is once you start your language process and you're 100% sure that you want to, start with your journey to come to Germany for your post graduation. Okay, next question. I already got approbation. Do you still help getting into dermatology? Like I said, we can have a one-on-one mentor call. We can set it up. It's a paid call, but then I can explain you the procedure again, how to get into it. But if you want a full 100% guidance, I can also help with that. We have services for the same, but for that, first we need to have a call to know exactly what your goals are, how you decide to, get into things and your main situation presently. But we can always initially just set a one-on-one call, see the whole procedure, and still if you feel you need my guidance, we can surely explore that as well. Can you please tell me which state to apply for? State with the least waiting period for FSP and KP exams. So presently there is a lot of doctors who are coming from other countries in Germany, and honestly, it depends. It's a very individual case scenario. I wouldn't be like this state is faster or this state is very slow. Sometimes it's a very individual based scenario. So I wouldn't say this state is better or that state is better. You have to like decide your priorities, but mostly the period depends for every state almost is similar. I wouldn't say it's like somewhere super long or somewhere super slow. Obviously, the bigger cities or the bigger places like Berlin and Munich, not Munich, but Berlin mostly, may have a little longer period, but it's not like a big difference. So, most of the waiting period time, I would say, is similar in every state. Hello, doctor. I'm doing MBBS from Georgia. Is it mandatory to get my license study from for my study country to apply for approbation? Like I said, this is a question for Dr. Nigel, and you can always refer to IFMG webinar because this has been answered in detail there. So I would definitely tell you to check that webinar. But as far as I know, that you do need license from both the places. Your degree needs to be recognized from your home country and your study country as well. But like I said, it's best that you refer to that webinar or set a one-on-one call with Dr. Nigel to get more information on this and to explore this more. So, does GAP in CV have an issue to get residency after approbation in Germany? Uh, Not really. It depends on what the gap is. If you formulate it correctly in your Anschreiben, that's your letter of purpose, which you send to the hospitals in Germany, I think that should not be a huge problem. And obviously, it depends on how long the gap is. Like if it's 1 2 years, or if it is 10 years, it's obviously that makes a difference. So it's again an individual based thing. But usually, if you give a concrete reason why the gap was there and what is the reason for it, so it's like I said, it's normally okay. Like in Germany, it is very much respected to take gaps, maybe because of parental leaves or any other issues, or just to take a break. But obviously, the gap, if it is more than like 5 10 years, then it makes a difference. But if it's a year or two, then if you give a reason, then it should be okay. So, which is the most difficult step in the entire journey? It's very hard to pinpoint which is the most difficult step, honestly. It's again for everyone, there are different steps which are difficult for them. For me individually, honestly, deciding that I want to come to Germany because of the whole different, because it's a different life here, right? Deciding that was a bit difficult, but obviously application process and getting into dermatology, because I was very, very sure that I just wanted to do dermatology. So for me, The application process was maybe a little difficult, mainly the language part, but I think that gets better over time. That is one hindrance which people see. Okay, I think I have to learn a new language, maybe I cannot do it. And that's where a lot of people decide, okay, I don't want to do it. But I want to let you all know, if all of you are thinking that, it is something will that shouldn't be a big hurdle, because that gets better over time. So if that is something that you're thinking that, okay, I have to learn the language, maybe I shouldn't take this path, I would say don't think that, because that's something comes with time, and then later you'll think, okay, it was not that difficult, good that I took that step and I did it. So I definitely recommend everyone that if that's something that's scaring you, I would tell you that take the courage and go for it, because that scared me also, and I feel a lot of you as well. But it comes with time, and it always works for the best. And I think, yeah, that was one of the most difficult step, deciding if I want to do it or not. And yeah, okay, let's go for the next question. After doing PG for 3 years in India, should we do rest of the residency there in Germany, or can we directly apply for jobs? I just explained this in the webinar about the PG in India and how it can get recognized in Germany. So you cannot directly apply for jobs. You have to first get your medical degree recognized with the FSP and KP. Then you can try getting the PG part recognized as well, but that's only for 3 years. And like I said, the PG here, non-surgical 5 years and surgical 6 years. So that deficit is always there. So one has to always finish that deficit. And in the best case scenarios, 3 years can be recognized, but in some cases, half of it is recognized or nothing is recognized, or in some cases, they recognize 3 years as just experience and give you a hike in your salary to the third year resident doctor. So we cannot directly apply for jobs, just to say it in short, but there are ways to get a lot, you know, around it. So next question. What's a realistic timeline for someone who completes internship, has cleared C1, wanting to get into neurosurgery? So, neurosurgery is the specialty of one of our co-founders, Dr. Faiz Sheikh. You can definitely talk about neurosurgery with him. He has also set up the 2 webinars about it. You can definitely go through those webinars as well. And they are all up on our YouTube channel. So, he has explained about it much better. And like I said, you can, for neurosurgery, I would definitely recommend setting one-on-one call with him, because he's an expert in it. And you can maybe first set a call with Mr. Jay Doshi, and he can tell you the further procedure. But just to give you like a realistic timeline, after C1 and everything for neurosurgery, first you have to clear your FSP, KP, get your visa. There are a lot of procedural steps, obviously, where we will be guiding you if you decide to come with us. And I would say 1-2 years you can take realistically, but it's again an individual based scenario. But you can obviously uh, take 1-2 years into consideration. But this is very much in detail explained in our earlier webinars. So I really request you to go to it and check it out. And if there are still any more questions about neurosurgery, please make sure that you set the one-on-one call. Okay. And links are in the comment section. I can, at the end of this, again put it up here so you guys can check it. We'll go to the next question. Is the government funding for FSP given even if we are preparing in India, or is moving to Germany really necessary for it? Uh, to be very honest, moving to Germany is necessary for it. In some scenarios, it's possible, but it's very rare scenario. So I'm not going to give any promises that, it's possible if you're preparing for it in India. So it's honestly saying a no. You have to be in Germany if you need that government funding, because there are different ways to apply for it. For that, you need your residence in Germany, and then only you can apply for it. So, because the funding is given by the German government, not from the Indian government. So, unless and until you're in Germany, the funding is difficult to be approved from India. How to apply for hospitations from India? I have completed B2, but is C1 required for hospitations? Do these hospitals have specific portals or do we have to directly mail them? Oh, this is a really good question. So you can apply for hospitations from India. Like my co-founder, Dr. Faiz Sheikh, had also applied from India and he had gone for hospitation in Germany. And yeah, you can apply with B2, but depends on which field you're applying, where you're applying. And that's where we come into play. We can always help you find the right hospitations for you according to the field, make your applications accordingly so you can apply for these hospitations. And where to mail, what to mail, everything, that's where we will guide you. So you can definitely, um, once you enroll with us, we can directly tell you how you have to apply for these hospitals on hospitations, and you can directly get in touch with us about this. Which states to apply as a fresh MBBS graduate from India? Like I said, you can apply to any state whichever you like according to your preference. If you know, like it completely varies on according to your preference. For the preparation or for the exam, it does not really make a huge difference. What I always tell the students is it's best to apply in the state, maybe where you have any relatives or friends, or maybe you know someone. So because that makes a huge difference to have someone, because loneliness in Germany is a big factor. We are used to a lot of people back home in India, but coming here, it's best. I would suggest, if you know anyone, if you have family, make sure you apply in that state. That would be my recommendation. So, I'm currently working as a non PG resident in India neurosurgery department, but I want to do my residency in dermatology. Will that be a problem later? Honestly, not really. Like you can work in neurosurgery, it always adds as a valued experience. Like you have experience on your CV. But obviously, to make, if you want to do dermatology in Germany, then we have to, find and navigate ways where we show that your CV is more oriented toward dermatology. But a big problem, I would say it won't be. Obviously, that's where we will guide you how to make your CV more oriented towards dermatology, and how we can make sure that, dermatology is more reflected on your CV than the neurosurgery part. Okay. And for that, again, like you can get in touch with us and we'll tell you how to navigate that whole thing. Next question. What's the costing like with or without funding? Costing of what exactly? We have a complete webinar on the costing, again, which was done by Dr. Faiz Sheikh. You can definitely refer that because we have explained in detail every cost of every step. I can just show you the link here once. Mm, yeah, this one. This is the Mastering Your German Course Strategy. This is the webinar link, and you can definitely go through this link, and the costings are completely explained in this link. So, yeah, I would just say refer to that webinar. Okay, and then we go to the next question. I'm just trying to, yeah. Is it true that dermatology is going to be a closed field in couple of years? No, not that I know of. I don't understand what you mean by closed field, like it won't be a field anymore or something. If that's what you mean, I don't think so. Because dermatology comprises of a lot of things, like I explained in the webinar, and I don't think that's going to be a closed field or anything. So if that's the question, then no, I don't think it's going to be closed. Just give me 1 second. So I'm just trying to understand this question more. Like, you mean close field for like foreign doctors or like what? Because if you mean for foreign doctors, I don't think so. Like I have 80% of the people who work here in dermatology or any other field are foreign doctors. So I don't think that's going to be a close field. Obviously, it is competitive and it has been competitive wherever you go, let it be India, let it be Germany, US, Australia. It's always going to be competitive, but closed, I wouldn't say it would be. Next question. As a Fakats, what branch is good earning branch in private public sector? Radio, dermat, ortho, plastic as such. I would say all of them now. Like you can again refer to the costing webinar, but I would say depends on how you navigate through it. Obviously, as a Fakats, all branches you can earn well, and yeah, radiology, dermatology, ortho, plastic, all of them. And like depends on how you want to work. You want to work under someone, you want to start your own private clinic, you want to work in a hospital. According to that, it depends. The salaries or earnings differ. Obviously, having your own private practice makes a difference, but a private practice in all the fields would earn you good amount of money. I wouldn't be like this. But there are branches like ophthalmology, radiology, dermatology, neurosurgery, obviously, where we can provide more, like you say, things to the patients. You can earn better. But orthopedy also and plastic surgery also definitely. So, but it depends on how you want to work. You want to work with someone, you want to work in the hospital, or have your own private clinic. Next question. Do we need to start residency in internal medicine first in order to get a residency in dermatology? I already answered this question during the webinar. So it's not a must, but if you do not get into dermatology directly in the first go, there is a possibility that one can definitely first go for internal medicine or the other fields like I mentioned in the webinar to for a year, for 6 months to 12 months, and keep applying in dermatology because that experience will be counted in your PG for up to 1 year. So you can apply it, but it's not a must. Other than post graduation, what else is considered as an experience, ma'am? Like working in a private hospital as a duty medical officer? Yes, that can also be possible. That can also be what do you call it, considered in your experience. If you're working as a GMO or a resident, which is not like a recognized PG residency, still you can show it as an experience. Every experience counts. You don't have to just have PG if you're working in a certain department and it's not like in the Indian PG curriculum, still it will be considered as an experience. And we can always try converting it here and showing it here. And that's where we can help you with, especially with these non-direct PG positions also. So that's where I can help you um, convert that into experience as well here. So next question. Is it easier to get jobs in smaller cities compared to bigger cities? Yeah, I think this rule is like it's applicable to all countries. In bigger cities, obviously, there is more competition. In smaller cities, I would say not that more of a competition. But yeah, there it makes a difference. It is a little bit easier to get into smaller cities than bigger cities, but you can always try applying to the bigger cities first. It's not something that is, you shouldn't apply at all. Like I started my first job from one of the biggest cities in Germany, that's in Cologne. And I started my first job there, my first hospitation there, and it worked out for me. So I wouldn't be like start with the smaller cities. I would apply everywhere and then compare whatever, suits my needs. So yeah, but it's easier in smaller cities. I'm planning for Lower Saxony State. Is it good state to apply in and give exams there? So that's neither Jackson. I guess that's the Hanover Medical Council. Yeah, the exams are relatively okay to give there. That's not a problem. Again, the state you have to choose according to where people are there, where what is there. The procedure is almost similar for every state, can be a little here and there in different documentation part, but yeah, you can apply it. It's a good state, and exams are also, you can give the exam step. But again, it's an individual based thing. We have certain states which we recommend to our students if they don't have any particular choice. But if you want to go to Lower Saxony, we can obviously guide you how to, apply from the Niedersachsen state. That's not a problem. What are FSP and KP exams about? So we have explained this in our webinar where we have explained the steps to do medical post-graduation in Germany. Please refer to that as well, because there we have given like a broad explanation about the FSP and the KP exams. Just to give you a brief idea about it, FSP is Fachsprachprüfung, that's your German language exam, German medical language exam where they test your German medical language, and KP is the Kenntnisprüfung where they test your medical language, like proper medical exam, like your medical entrance exam kind of a thing, where you have to examine a patient and you'll be like sitting with three, four professors who will, ask you medicine related questions comprising of different subjects. But like I said, the broad explanation we have explained in our webinars and in our videos on YouTube. Please refer to those because there you'll have a concrete idea about what exactly are these exams about. Is it possible to apply to hospitals for a specialty without yet having the required German language certificate? For example, applying now to start the specialty at the end of 2027. Mm, I mean, if you want to apply for your post graduation, firstly, you need your Berufserlaubnis, that's a temporary license, or your approbation, that's your permanent license, and you do require medical language certificate to apply for this. Like even to apply for hospitations in Germany, I would say minimum B2 is required. So like if you're like it depends where you are. If you're in India, you have a B2, maybe you can apply for a hospitation. If you're here, you have your German language, which is B2 or C1, and your license, then you can apply. But without these things, that's your German language, I don't think you can apply and you can get into any specialty. Like you can't be like, I want to apply now and I'll finish my language till then. And usually it doesn't work that way. Exactly, having obtained the certificate by then. I would say I don't think that would work that way. Usually they are very direct. They need those certificates, and unless and until you have it, and like it won't work out. How far in advance do you need to apply to hospitals to start your specialization? Honestly, you can apply it after you clear your licensing exam or your FSP exam for the temporary license. But it's not like you have to apply 1 year in advance or 2 years in advance. You can apply if they have a position free that time, they call you for an interview, depending on that. There's not a specific timeline that you have to apply like 1 year before there because the position will be free there later on. So I would say apply as soon as you get your medical license. Is it actually possible to practice dermatology in Germany, even in a smaller town? Yes, definitely. Oops, sorry. Yeah, it's definitely possible to practice dermatology. I myself, I am practicing, and like I'm practicing in a good city, and yeah, it's possible. And if you want to practice later after your post graduation with your private clinic, that is also possible in Germany, like how we do it back home. So yeah, it's definitely possible. Is the specialty selection system the same in Switzerland? Um, it's almost similar, I would say. I wouldn't say same because Switzerland has a little different rules. Some people, what they do is that they finish their specialty training in Germany and they give certain recognition process, certain exams, not exams, but there is a process where you can apply for the recognition in Switzerland and then you can shift there. In Switzerland the system is a little different, and yeah, but I wouldn't say it's exactly same as Germany. It's a little different. And in Switzerland, I would say C1 is a must. And then even after your post graduation is done, you have to work under doctors for around, I would say, 3 years to have a independent practice or something. But that's a completely different topic. But like I said, it's a little different. I'm interested for a free discovery call. How do I do it? So you can have a free discovery call with our operational manager, Mr. Jay Doshi. You can just write down us a mail, or you can message Mr. Jay Doshi in WhatsApp. We can share the number, which is written down below, the WhatsApp number here, and then we can set up the free discovery call for you. Are there any specific hospitals in India whose rotations are recognized or considered or valid in Germany? Like I explained in the webinar, the hospital have to comprise of those topics or those subjects which are included in the logbook, and complete recognition, it depends on what is filled in that logbook format. I wouldn't say it's valid. You cannot just directly have that degree from your hospital and directly apply to a hospital in Germany to work. There will be a part which will be deficit, and that has to be covered in Germany. So it doesn't depend, like it does not really matter directly which hospital you were in India. It matters what was covered during that period in your logbook in that hospital in India, and that when covered, then the remaining deficit can be covered in Germany. So that's how it works. Doing an internship in Spain could help you get selected for dermatology specialty when you apply to a German hospital. Uh, I honestly have not much information on this, I'll be very honest. But if you are back home in India, then I would say it, honestly, I wouldn't say. Obviously, it will help if you have experience in any country in any part of the world. But if you're working in Spain and you have any experience in dermatology, obviously that's going to help you CV get more stronger. If that is your question, that's what you mean. Um, so if you have an opportunity and you're getting more dermatological experience in Europe, that would definitely strengthen the CV. So yeah. How much does your program cost in total? So we don't have for this. I would definitely tell you have a free discovery call with Mr. Jay Doshi, because he handles the costs and everything, and he will discuss all the costs with you on the call. You can definitely WhatsApp on the number and check through it. And if you are asking regarding the costs of doing post graduation in Germany, for that we have the whole webinar. Like I showed you the link below. You can definitely go through that to know exactly the costs that are possible. And we have kind of mentioned our cost in that webinar as well, so you'll get an idea about it. But if you need to know like a specific um, cost this thing, then please contact Mr. Jaidoshi. He'll definitely give you the main costings of the whole thing. So next question. Doing an internship in your home country could help you get selected when you apply. I think this question we just discussed, so I'm going to go ahead to the next question. Can we start our residency after clearing FSP and clear KP within 2 years of that? Is it true, or do we essentially need to clear both exam to start residency? It's again individual based and the hospital based scenario. Some hospitals where you start working after your FSPs, it's like the contractors made. They will tell you before you start working if they can recognize it in your PG or not. But some hospitals say no, it's only considered as an experience and it won't be recognized in your PG. So it's not like a one stop or a one rule for all the hospitals. It depends on where you apply. But most of the times, I would suggest, clear your KP and start to be on the um, clearer pathway. But Obviously, it depends hospital to hospital. If you ask them before you start working if that will be recognized in your PG and they write it down and give it to you in your contract, then yeah, maybe. But you need to clear that with the hospital where you apply to. It's not like a one rule for everything. So, when exactly can one start earning or support himself after relocating to Germany if he just has his MBBS with a A2 B1 level certificate? This again we have explained in the webinar of the costing and finances. So again, for like a proper detailed idea about this, please refer back to that webinar. But usually you can start earning immediately of your FSP as a doctor on the temporary license, or sometimes you can also get to do mini jobs in hospital. Those are like 10 to 20 hours jobs where you can earn enough money to support yourself. Like here. But I would say refer to the webinar which we have made on the finances where we have explained that much, much more in detail. Doing an internship in your home country, yeah, it's the same question again. How much early should one start sending application for hospitation, like if someone wants to start one in Jan 2027? Doesn't depend when you want to start the hospitation. It depends once you have your B2 language certificate, I would start applying for the hospitations. So if you have right now your B2 language certificate, you send the applications and you can tell them that you want to start working from Jan 2027. But like there's no early or late this thing. Obviously, if you send it in Jan and tell them you want to come, that doesn't work that way because obviously you have to apply for visa and there are a lot of other things that come into consideration. So main point being you need to have your language certificate, and if you have that you can start and then consider for your visa 3 4 months, like 3 4 months of processing time to start the hospitation. Like I said, for this also we can help you, and you can always contact us for this. Can we apply for residency spots even with a temporary license, because in Romania final license takes time to be ready, like around 1 year. Uh, I think this is a similar question to what we had earlier. If we can start residency after FSP with the temporary license. Again, like I said, it's a hospital to hospital scenario. But yeah, you can apply for it, but it depends on what contract you have with the hospital. If someone gets admitted to 2-year diploma family medicine in India, can it add value to CV? Like since it will anyway take 1.5 years for the whole thing side by side. Obviously, it can add value to your CV. Any experience count. I've always said that family medicine is like a family doctor here in Germany. There are a lot of them, and if that's the specialty you want to follow ahead, you can. It definitely will add value to it. And obviously, in family medicine, there are a lot of things that are in. It comprises of a broad spectrum medical treatments and everything, and that will definitely add value to your CV. So if you're doing that and alongside preparing for your German, um, what do you call it, the German language and everything, so yeah, it will add value to it. Or any 2-year diploma as such. Like I said, any experience in your desired field counts and helps to make your CV stronger. So I would definitely advise, if you're wanting to go through that field or something, you can definitely apply for it. But I have already applied in a different agency, but they have no idea how to apply for hospitation. Please, could you help in that? Um, you can set a one-on-one call with us and we can definitely go through your scenario once, and I can help you with the hospitation, but I first need to understand the whole scenario, how it is, and then only I can promise something on it. But like I said, you can set up a one-on-one call. We can surely explore the situation. I have 7+ year experience working as a medical officer in primary health center in India. Is the experience count if I join my PG this year and apply jobs in Germany after third year of my PG? So exactly in what field you have, it depends on that. If you worked in primary health center as a GMO, and it is not associated with the field that you're applying at Germany, then it cannot be recognized in your PG years. But if it is the same field, there is a possibility of it. But if it is just if you're applying for a different field altogether, then it's difficult to get it recognized in your PG. But maybe with that 7 years, you can get a hike in your salary in your PG. That is also possible, but for that obviously we have to go through the whole application process. um okay, last question: does Germany too follow same residency plan like India? I mean, does every hospital have PG or 1 2, like so on in every specialty? Like I explained in the webinar, it's a 5 year PG plan and 6 year PG plan for surgical fields. So it does have a different, I wouldn't say it's exactly the same. There is a different type of mentorship. Like sometimes you have to change hospitals to get some things filled in your logbook or get the other spectrums covered. So it's not like in India that you apply for a PG seat and then 3 years stay there and do your thesis and end of it. Here it's a little different. It's more flexible, I would say. And then you get to learn from different PG guys, different HODs, different things. And I feel that adds a lot of value to your medical knowledge. So it's a bit different. But yeah. Okay. So I guess I have answered all the questions. And yeah, I think that was a really nice webinar, and I hope it helped you guys get a little bit of insight into things. And if you still have any more questions or if you still want to explore the idea, please make sure that you set a call with us. If you want to enroll with us, set a call also with us, or you can message on the WhatsApp number, and we can surely, explore the whole plan with you ahead, and we can help you in every step. Let it be your hospitation, let it be your visa interviews, PG applications, and we can definitely explore the whole thing. I hope, yeah. So I hope you guys have a good Sunday ahead, and I will see you soon. Thank you.